now that we've reviewed the functions of the different blood components and the formed elements, we're going to be moving to looking at blood disorders. For the blood disorders, what we're interested in is what happens when those blood cells either increase or decrease. So as we start to consider blood disorders then, there's different categories that the blood disorders can fit in. So we can break it down basically into 4 types. The first way we can categorize them is based on whether they originate from within the blood itself. In primary disorders, the issue arises from within the blood itself, whereas in a secondary disorder, the issue is a consequence of another disease, process, or treatment. For example, polycythemia is when there is an increase in red blood cells, and that can thicken the blood and put stress on the heart. Primary polycythemia is caused by the bone marrow becoming hyperplastic or having hyperplasia, and that increases the number of blood cells. In secondary polycythemia, there's a reduced oxygen. So the body's compensatory mechanism kicks in, and we start to produce more red blood cells. So the reduced oxygen can come from a different disorder like emphysema, COPD, or heart disease. In qualitative disorders, there are cell abnormalities or dysfunction, and in quantitative diseases, there can be an increase or decrease in cell production or destruction. So in qualitative, the disease example would be hemophilia, and it's due to a coagulation factor deficiency. Whereas a quantitative disorder would be something like thrombocytopenia, where there's an increase in platelet destruction causing a decrease in circulating platelets, and that can lead then to increase in bleeding. So let's take a look at some more common quantitative blood disorders before we go ahead and get into specifics. So this chart is helpful for laying out the names of each of the formed elements. So we can see erythrocytes, white blood cells, platelets, and then whether or not there's an increase or decrease and what the disorders can be. So as we look at erythrocytes or our red blood cells, we can see that an increase in their number is called polycythemia. That can be caused by a decrease in oxygen or hypoxia from either a disease or even a change in the location. So for instance, moving from an area of lower elevation to an area of higher elevation. It can also be caused by genetic mutations. Erythropoietin, that's the hormone that triggers red blood cell production. We can have erythropoietin secreting hormones. Some people inject the hormone EPO, and that can lead to polycythemia. In the past, athletes have abused that, or even kidney disease. When there is a decrease in the red blood cells, anemia results. There can be different types of anemia, and we're going to be discussing those in further detail. When there's an increase in our white blood cells, it can be because of an infection. However, when their precursor or blast cells increase, it can be a sign of leukemia, which is a liquid tumor in the blood. The issue here is that even though there might be an increase in the white blood cell numbers, they are immature cells and they don't carry out their immune system responsibilities. So people become susceptible to opportunistic infections. When there are a decrease in the numbers of white blood cells, it's called leukopenia. And the most common type is neutropenia, or a decrease in the neutrophils. Lymphocytopenia is a decrease in the number of lymphocytes, and that's less common to see. Leukopenia can be caused by a decrease in cell production if somebody has a folic acid deficiency. Cancer treatments like chemotherapy and radiation, or even cancer itself, congenital diseases, or aplastic anemia. Lastly, then, we have our platelets. An increase in platelets is called thrombocytosis. That results because of bleeding, cancer, iron deficiency, inflammatory disorders, trauma, or surgery. If there are too few platelets, it's called thrombocytopenia, and that can be caused by drugs, leukemia, sequestration of the platelets by the spleen, viral infections, cancer therapy, or even pregnancy. We're going to shift gears now and start to look at specific disorders. So our first one is anemia. And anemia is when there is a decrease in oxygen carrying capacity that results in a decreased oxygen delivered to our body's tissues. And that can be from insufficient erythrocytes or decreased hemoglobin. There's multiple forms of anemia, and each can have different underlying causes. As well, there can be a spectrum of severity, with some conditions being very mild to those that are very severe and even life-threatening. As well, we see patients that can have acute anemia or chronic anemia. Anemia is the most common blood disorder, and it affects about 3 million Americans. As we look at the pathogenesis of anemia, remember that there are different forms. They all stem from 3 main causes, but the mechanisms behind the etiologies can be different. So the 3 causes are blood loss, for example, a sudden hemorrhage, trauma, internal bleeding like an ulcer, or from even a surgery procedure. Anemia can result from a decrease in red blood cell production or an increase in destruction. And they can also be because of genetic disorders, cancers, chronic infections, autoimmune disorders, malnutrition, or absorption. And it can be triggered by premature hemolysis, like in sickle cell anemia, or infection, liver or kidney diseases, and even some drugs. Our clinical manifestations that we see in people who have anemia, they're tired all the time, they have weakness, they have a pale skin, they can sometimes have a rapid or irregular heartbeat, dyspnea, which is shortness of breath, they can feel dizzy or lightheaded, have a headache, they can have chest pain, and they also report cold hands and feet. So, causes of anemia. So the first is blood loss. So blood loss can cause anemia, and it can be acute, like surgery or trauma that can cause a hemorrhage. The treatment here would include replacing the blood volume loss and repairing the injury then that caused the acute hemorrhage. Chronic blood loss can occur because of internal bleeding, such as an ulcer, cancer in the GI tract, or even abnormal menstrual blood loss. So again, treatment would include treating that underlying cause of blood loss. And in chronic, it may also include iron supplementation. So anemia, like we mentioned before, can be because of a decrease in erythrocyte production. So aplastic anemia is when there is a general decrease in all of the blood cells, and that's called pancytopenia. And that's from a decrease in stem cell proliferation. It can be caused by congenital disorders like chromosomal abnormalities or acquired like autoimmune system disorders. Cancer treatment and infection can also lead to aplastic anemia. About 50% of the cases are idiopathic, meaning there is no known cause. There are also what we call anemia of chronic disease. And here, chronic infections like HIV, inflammatory disorders like rheumatoid arthritis, or cancer can decrease our red blood cell production. An increase in erythrocyte destruction can also lead to anemia. Hemolytic anemia is caused by hemolysis of our red blood cells, and here it can be acquired or inherited. So acquired hemolytic anemia can be caused by infections, certain drugs, blood cancers, autoimmune diseases like lupus, hypersplenism, which is an overactive spleen, or a blood transfusion reaction. Sickle cell anemia is an inherited hemolytic disease with abnormal hemoglobin synthesis that causes the red blood cells to be sickle or C-shaped. The cells then can block the vasculature, causing ischemia and organ failure. The abnormal cells don't have the same lifespan as typical red blood cells. Lastly, another inherited type of anemia is thalassemia, which is a group of genetic diseases that's common to Mediterranean, Asian, and African populations. And here, the genetic mutation causes defective hemoglobin and hemolysis. Low hemoglobin content in circulating red blood cells can also lead to anemia. Our pernicious anemia is probably an autoimmune disease where the gastric cells that make something called intrinsic factor that's necessary for the absorption of the B12 vitamin, those cells are destroyed. So there's a lack of B12, and B12 vitamin is necessary for red blood cell production. Iron deficiency anemia can be from inadequate iron intake or absorption of the iron. It can be from pregnancy, blood loss, or hemolysis from mechanical red blood cell trauma. So from, for instance, cardiopulmonary bypass procedures. Iron deficiency anemia affects about 10 to 30% of adults in the U.S. And for these deficiencies, the mineral iron can be administered. Diagnosis of anemias can begin with a CBC, or what we call a complete blood count, and hematocrit, where the number of red blood cells, the volume, can be assessed. So the amount of hemoglobin can also be quantified, and the morphology of cells can be helpful in aiding the diagnosis of anemia. Genetic tests can also diagnose the inheritable forms of anemia. Treating anemia is varied depending on the type and severity. And anemia is caused by deficiency. Supplementation, either orally or enterally, can be given for iron, B12, or folate, depending on the issue for the patient. In anemia of chronic disease, treating the underlying disease is necessary. Anemia caused by kidney disease may need treatment with erythropoietin, the hormone that can trigger red blood cell production. Aplastic anemia and the inheritable hemolytic disorders are also treated with blood transfusions or bone marrow transplants. And then anemias that are caused by autoimmune disorders can be treated with immunosuppressants. Leukopenia is an abnormal decrease in the number of circulating white blood cells. Since neutrophils make up the majority of the circulating white blood cells, neutropenia is the most common leukopenia. That's a mouthful, isn't it? So the neutrophils, remember, are phagocytic cells that are involved in fighting bacterial infections. Neutropenia weakens the immune system, and the patient is at a greater risk for infection. The severity of the risk of infection is inversely proportional to the number of neutrophils. So the fewer the neutrophils, the greater the risk of a life-threatening infection. Similar to red blood cells, the decrease in the number of neutrophils can stem from decreased production or increased destruction. It can also occur from cells leaving the bloodstream and relocating into tissue compartments. It can be congenital or from birth. Genetic mutations have been identified that cause congenital neutropenia. It can also be acquired. So acquired neutropenia can result from autoimmune disorders where autoantibodies bind to neutrophils or their progenitors. And there can be two types. So primary, in which the neutropenia is the only pathology, or secondary, in which the neutropenia is caused by another condition like systemic autoimmune disease like lupus or rheumatoid arthritis, or infections like HIV, radiation of bone marrow, and hematologic cancers can also cause neutropenia.